Employees of maternity wards, OBGYNs, midwives, nurses, etc. What's the worst case of you shouldn't be a parent you've seen? Was a student nurse shadowing a community health visited a pregnant woman who hadn't found out the gender of the baby yet. She, for some reason, told us that her boyfriend, father of the baby, had been previously convicted of SA against a child under 13. The mother said it so casually and was angry that people kept judging him for a mistake he made. The health visitor was horrified and asked if she wasn't worried he would hurt her sons, 2 boys under 10 from a previous relationship. She just said, "Of course not, they're boys," basically admitting this man did something to a young girl. So health visitor asked, "What if the baby you're having now is a girl?" This woman literally shrugged and said, quote, "Then I'll abort it and we'll try again till we get a boy." She said it so casually, like she was talking about the weather. I've never been more disgusting with a human, and I hope that the children are safe. Next story. I volunteer in an NICU. Recently, a dad who refused to be on the birth certificate started arguing and being a jerk. The baby was sleeping and he woke up. The nurse said he handled the baby roughly. They ended up having to ban him from the NICU. CPS was involved already, and hopefully they continue to be. Next story. My wife and I did foster care. We took in a 4-month-old girl and had her for over a year, and then were offered the opportunity to adopt after parental rights were terminated. You don't bond with a baby and then break that bond, so we started the adoption process. Close to completion, bio-egg donor and bio-sperm donor had another, who was immediately taken by CPS. The little guy spent his first 2 months in NICU with a brain bleed and drug detox, and we now had a choice: adopt them both or back out. They were to be a matched set. There may be more, but they would be after our case was closed and sealed. They were bad enough that any further children born to them would be immediately taken by CPS. I'm now the proud dad of thriving 10 and 12-year-olds. Next story. I was on a L&D unit as a student nurse. We had a young mother in who had just given birth to her second child. The mother refused to stop smoking marijuana for her whole pregnancy, as she didn't feel that there was enough evidence to say that it was harmful to the baby. Her child was born early, underweight, and with other illnesses that will follow them through life. She couldn't go more than 2 hours without going outside to smoke a joint, even if that meant leaving the baby alone in the room. Refused to tell the nursing staff when she was stepping out. Or with her young cousin who did not know how to hold a baby, and almost let the baby aspirate on its own vomit. We had to increase her room checks to every 20 minutes out of fear for the infant's safety. The cherry on top is that while all this was going on, her first child was down the hall in the peds unit for juvenile diabetes management. She had already chosen to let her first kid stay full-time with his father, as she didn't feel like she could care for him until she, quote, got her crap together. She didn't visit her son, not even once, though he was maybe 30 feet away. There are far, far worse cases out there, to be sure. I just can't help but wonder how both those kids are now. Next story. Paramedic here. I used to occasionally do interfacility transports with the NICU team, nurse practitioner, RN, and myself in the back, though they do most of the heavy lifting. And so many opioid-addicted newborns. I remember the first time I had to calculate a fentanyl drip for a 6-pound baby so he didn't go into withdrawals. Can't get clean for the pregnancy, but also refuse to do anything to prevent pregnancy. It's heartbreaking. Next story. Not really the gist of the question, but at a house party, a gal who was so drunk she couldn't stand up and nearly burnt holes in the furniture with her smokes and bong announced, in a comically loud stage whisper, that she was a few months pregnant, but not to worry, because she'd already scheduled an abortion. The entire room heaved a sigh of relief, given she'd already had 4 other children seized by the state. Then someone asked why she didn't just use birth control. Her answer? You can't prove that stuff works, and also, I'm not going to pollute my body with hormones. Wow. I feel sorry for her remaining eggs. Next story. Not a medical professional, but my baby was born premature and spent a little over a month in the NICU. It was the hardest thing I've ever experienced. My wife and I were fortunate enough to be able to do shifts and care for our little guy almost around the clock. The baby next to us was born the same day as our son and looked to have a similar experience with needing a ventilator and oxygen. To my knowledge, not once in those 34 days did he have a visitor or anyone to hold him and comfort him besides the excellent nurses there. I think about that baby a lot, and I really hope he graduated and found a home with people who will love him a great deal. Next story. I worked in mother baby for over 10 years. I saw many questionable parents. Drug users that were high, no parental care, parents that would curse at their newborn and tell the baby to shut up. women with mental health disorders that were, at the time, dangerous to their child, a mother fighting with her baby daddy that was throwing things, food tray and such, across the room at him, with the baby in the midst. Another thing I hated to see were parents telling people not to hold their newborn because it would spoil the baby. Once had parents leave a newborn alone in the room to go outside and smoke/do drugs. Had parents threaten to sue us because we made their baby a birth certificate. Had a young mom with 4 kids, 3 and under. When it was time to go home, she stuck all the children in a car back seat. Only the newborn had a car seat. Sometimes the police would be waiting outside at discharge if one of the parents had a warrant out for arrest. Lots of sad situations. Next story. I was a male registered nurse for 21 years, specializing in adolescent and children's psychiatric care. When I was in nursing school, I was very fortunate to have gotten to observe and/or participate in 6 births. My preceptor, a female LNDRN, was determined that male nursing students should get the same OB/GYN nursing rotation experience as the female students. One birth I attended was a 16-year-old mother who was infected with genital warts and herpes in the vagina and birth canal. The MD had decided to do a cesarean section because of the danger to the baby. The father was an 18-year-old member of the Bloods gang who showed up in full gang regalia, all red, hat turned sideways, tons of gold jewelry, etc. My mom was to get the father ready to go to the operating room to accompany the mother during the C-section. It was a struggle convincing him to disrobe out of all that gang stuff and put on scrubs. It didn't help that the scrubs were blue, the color of his gang rivals, the Crips. Eventually, we got him there, and to his credit, he didn't pass out, and he held her hand and talked to her during the procedure. She was awake but sedated. The MD used a caudal block, spinal anesthesia. The best moment for me was when the neonatal nurse handed the gangbanger his son after the AP/GAR scores and all that. I thought to myself, this guy's gangbanging days are over. He's a daddy now. He's got more important crap to do. I really, really hope the two of them got their crap together, for the baby's sake. Yeah, I agree. Hopefully that's the end of gangbanging and time to be a dad. Do what's right by your kid. So props to him for even putting the scrubs on. Gotta love it. Next story. Not an employee, but a good friend of mine has adopted 2 babies from the foster system who are half-siblings. No idea who the dads are, but they have the same mom. The mom is in her 30s and has had 9 babies now. She's a sex worker and drug addict, but whenever she finds out she's pregnant, she does something to go to jail where she gets clean and gives birth. Last baby she had him alone in her cell and just left him on the floor while she went back to bed. Thankfully, guards found him before he froze to death. He's the most gorgeous 3-year-old now. They know where 5 of the 9 siblings, all adopted, are and keep them in touch with one another. Next story. Not a medical professional, but my folks own a group home that specializes in caring for medically complex young children who require 24-hour nurse care. Most of their kids have been wards of the state, aside from the terribly sad drug situations others have posted about. They commonly get kids who have issues due to drugs during pregnancy. One case that stands out to me is a woman who apparently drank bleach regularly throughout her pregnancy, hoping her kid would turn out blonde, ruined the baby's brain, and caused a lot of other serious medical issues. Next story. Family medicine clinic here. We had a woman from out of town bring her 5-year-old in. Kid's healthy enough, but they both stink to high heaven. Like, the smell lingered in the exam room after they left for hours. Mom's feet and clothes are filthy. Turns out, Mom also needed medical care because she was pregnant and had been having some vaginal bleeding. Mom has had 2 miscarriages in the last year, has had no parental care, already has 5 kids, only 1 or 2 with her, and is living in an old camping trailer with boyfriend and kids. Boyfriend made her come to the doctor because of the bleeding. She didn't think it was a big deal. She was supposed to come in for a follow-up, but they left town the next week. They were traveling in the trailer and wanted to let the kids decide where they stayed. I hope she's okay, but I'm doubtful. Next story. Not who you're asking about, but my husband's mother was 40, morbidly obese, an alcoholic, and barely not homeless. She had miscarriage after miscarriage and was found to have a uterine tumor the size of a football. But she begged them to let her keep at least 1 ovary so she could keep trying to have a baby, even though he would 100% for sure be very preterm because she didn't have enough uterus for him to grow in. The guy who finally gave her that preterm baby was someone she met in a bar that God told her would give her a baby. They were told my husband had an extremely high chance of never walking, talking, or learning to use the bathroom, but that was okay because his mom really wanted a baby. Even if he was basically a baby forever, Looking at the photos, I find it hard to believe the people who brought the apnea monitor and other medical equipment didn't have an issue with how cramped or cluttered the room was. The only reason my mother-in-law even got this house, that's 100% my husband's, now as it should be, is because of some program for low-income mothers of high-risk infants. Thankfully, the doctors were wrong about my husband being disabled. Unfortunately, that means my mother-in-law's religion was proven right in her eyes. Next story. I'm not an employee of a maternity ward, but I did see something awful when I went to go visit my friend after she had her baby. Her husband was just sitting in the corner of the room, playing on his Switch while she's recovering from hemorrhaging and almost dying, and trying to figure out how to take care of a baby. Things got so bad they had to resuscitate her. So when we got there a few days later, she was still looking horrible. When she was changing his diaper, I could tell she had never changed a baby's diaper before, let alone a boy's diaper. I tried to warn her about how boys can pee, but it was too late, and the baby peed all over her. My husband and I are trying to help her out and get a nurse to come get her changed, and her husband is still sitting in the corner playing on a Switch and ignoring everything. When the nurse got in there, my friend eventually snapped and yelled at her husband to help her. Me and my husband and the nurse just awkwardly looked at each other. I can't imagine how many times nurses have to see situations like that. It would piss me off so bad. Next story. In my L&D/postpartum rotation as a student nurse, 20 plus years ago, I took care of a 13-year-old girl who had given birth to a premature baby, and the baby had some serious medical problems, so was transferred to the children's hospital right next door. I worked nights, so I was able to wheel the teenage mom over to see her baby. The teenage mom was in the custody of the state, living in a group home, and had gotten pregnant from a teenage boy in the group home. So the baby was a ward of the state, and custody of the child was in question. Her mom, the baby's grandma, came to visit. I needed to stay in the room because it was a supervised visit, and it was both heartbreaking and terrifying to hear the mom/grandma go on about how the judge would give the preemie to her because she was blood related. Some of the teenage mom's friends came to visit her, and they were talking about how fun it would be to dress the baby up and play with it. Like, they were acting like you would expect most 13 and 14-year-olds with minimal experience in the reality of caring for a baby, let alone a preemie. While I couldn't say anything to the family, I had some thoughts and feelings about this. Grandma, all of your children are in states of custody because of the medical neglect and your continued alcohol abuse. No judge is going to give you custody of a preemie with major medical problems that will persist for the child's whole life. Mom, your child is not a toy doll. Your child will live in an NICU for months, and when the baby does come home, it will need around-the-clock care for the rest of his life. No judge is going to give custody of this child to a 14-year-old who's living in a group home. Next story. My daughter had a bunch of medical problems as a baby and was hospitalized at 4 days old, and we were on the pediatrics floor. Her heart read failure to thrive. She was losing weight despite having an NG tube, and her blood pressure kept dropping G randomly. Every shift change, a nurse would happily burst in the room and was shocked a parent was there. After the third day, I asked, and they explained that failure to thrive almost always meant parents were not caring for the baby. So the assigned nurse knew they would have a great shift of cuddling a baby, because they knew that cuddled babies thrive better. It made me sad to realize that people would leave their kids for days, even weeks, because they didn't want to be there. I can understand if they have to work, or only single and have other children. The nurses explained this was not often the case. Next story. Not a nurse, but a former high school classmate of mine who joined the military to shoot Muslims and has incredibly misogynistic views against women, had a baby girl at 19 with a woman he knew for a month or two before his kid's conception. I have him friended on Discord and see that he spends 4+ hours a day effing around with video games instead of helping his newlywed wife and barely 3-month-old daughter. Next story. I don't work in L&D, but both my living kids spent some time in NICU. The saddest thing to me was how few visitors there were in the NICU each time we went. It's a 50-bed NICU, and often we were the only ones there. The first time I visited my youngest baby, when I was still inpatient, I didn't talk to anyone in the unit about it. I tried to walk out to the elevator in my hospital gown. I knew where the NICU was already. The lady at the desk yelled at me to come back and made me put my name down. I said, "I'm just going to see my baby." And she said they had to keep track of moms coming and going because they had had moms just leave and never come back, abandoning their babies. Next story. My worst one was a consultation with a woman who had her daughters taken away because their dad, biological, was essaying them. She had 7 or 8 kids, I can't remember, and was pregnant again. There were so many issues. Housing wasn't good enough because of mold, small house, both were doing drugs and drinking. No family support, neither worked. Her toddler son was dirty, nappy, looked heavy, no shoes on, and he had to walk. I never felt like shaking a patient before. At the time, I was struggling to get pregnant, and it just broke my heart knowing my foster child could have experienced some of this. Next story. OB nurse. Honestly, I've only seen 2, and both had been previously convicted of non-accidental traumatic injury to their infants, one of which resulted in death. I think the only people who shouldn't be parents are folks who don't want kids or want to harm kids. Interestingly enough, it's not always apparent until years later when kiddo isn't a cute baby anymore. I've taken care of lots of patients with substance use issues. Lots of them would never want to hurt their baby. They beat themselves up knowing that their addiction resulted in pain for their child. And lots of folks literally don't know that their actions can harm the baby. Poor health literacy is very real. Next story. Not the worst of the worst, but I was caring for a new mom who was planning to breastfeed. I offered to help her get the baby, only an hour or 2 old at this point, latched to try to feed. Mom said, "No thanks, I think I'll start tomorrow so I can rest today." I asked her if she wanted a bottle to feed the baby for now, and she declined, saying she only wanted her baby to be breastfed by her. I had to explain to her that the baby couldn't wait until tomorrow to be fed, and she seemed genuinely surprised, like she could not wrap her head around the fact that the baby needed to be fed earlier than when she decides she's ready. Again, not the worst by any means, but left me a little nervous for the baby. Another time, I had a couple come in to have their first baby together. They each had kids from previous relationships, but did not have custody of any of them, something they made sure we all knew. They kept saying that they were, quote, gonna do it right this time. Dad was excited to have 2 days of paternity leave from his job at Arby's, and Mom was unemployed. They reeked of cigarettes, and Mom had tested positive for drugs, meth and fentanyl, and baby went straight to NICU for detox. So social services was already involved before they even left the hospital. I genuinely worried for that baby. Had a mom with several kids come in to deliver another one. She had a CPS case open, but had been evading the courts. We had a caseworker waiting on the unit for her on the day of her induction to take her current kids away and eventually take her newborn after delivery. Next story. A patient in labor was brought into the hospital by her boyfriend because her water broke. The patient and the boyfriend both had a panic attack when we told them that they had to take an elevator up to the 2nd floor because that's where our labor and delivery ward was. It turns out both of them are deathly afraid of heights and being off the ground floor. It took hours to convince the couple that they needed to come up to the 2nd floor of the hospital so they could deliver her child. Next story. I have had 2 different patients this year who showed, while still in the hospital, that they shouldn't have had their babies. Both of them threw fits that they were too tired to feed or take care of their babies, and the nurses should. One asked what the nurses were there for, if not to take care of the baby, because she didn't want to. The other one said she was too tired and didn't want to feed the baby. That one came to the ER at least once in the months after the baby arrived to say she was too tired to take care of the baby, and they should watch him like they're a daycare center. And also recently needed a pregnancy test because she thought she might be pregnant again. Next story. My sister works in labor and delivery, so I'll give you an answer nobody wants to hear. People with Down syndrome. They can't raise children and scream when their babies are taken away because they think they can. They're taking my baby! It's haunting and sad. It really makes you look at those, how cute, those 2 Down syndrome people are going to prom together, pictures differently. Next story. Well, I was a CPS social worker, but this story took place in a maternity ward. An addict mother had stayed off heroin for a few days because she was scared of testing positive while birthing her baby. Gave birth. Baby's father/boyfriend snuck some heroin into her while still in the hospital. She nodded off and dropped the newborn out of her arms and onto the floor. Thankfully, the little girl was okay in the end. A little bruised and some withdrawal symptoms, as well as small for her age, but I kept track of her until she was 6 or 7 and she was thriving. Her parents refused rehab or doing anything, so she was adopted very early by a great family. Love to hear this for the little girl. Obviously, the parents need to help themselves before they're fit to raise a child, so good to hear that she was adopted by a great family and that she's okay. Next story. Not an employee, but a parent. January of this year, my child had to be lifelined to a specialized children's hospital. While we were there in the PICU, a young baby, 6 months old I believe, arrived and was placed in the private room next to ours. I didn't think anything of it at first, but then noticed all the police. CID was there, the whole 9 yards. The parents weren't allowed in the room unsupervised at all. After a day, we heard a commotion from one of the other side rooms, and it was the mother getting irate over being questioned when she did nothing wrong. Later on, it's the same thing, but with the dad. The next day, a woman turned up with 2 other children. They were this baby's auntie and siblings. Let's say they didn't keep their conversation very private, and everyone in there found out why that little baby was there. The baby had several fractures and breaks. 2 days later, both parents were escorted out of the hospital in handcuffs. Read a newspaper article a few days after that the other 2 children were placed into foster care. They had medical histories of accidents, too. Those 2 people should never have been parents. Next story. Woman came in and gave birth to her 9th child. All other children already in care. Awaiting the meeting with social services, etc., she decides to leave the baby unattended so she can go and smoke a joint with her new boyfriend, not the father. Didn't tell any of the staff she was leaving, and they only realized she was gone when they went in to check why he was crying and if mom needed assistance. She was obviously not there, so security was called. They found her outside getting high, and she had the audacity to tell the staff that they were making a fuss and should have just let the baby cry. Next story. Not an employee of a maternity ward, but this deserves to be mentioned somewhere. A childhood friend of mine had a baby at 18. Whilst I didn't want to judge, as she seemed quite happy with that, I was worried that she's always been a little childish and airheaded. One day I'm at a bus station waiting for a bus home, and I see her pushing a pram over to get the same bus as me. I go and say hi to her and her son. That's when I look into the pram. At first, I don't even realize the baby was there, as it was underneath a dog and multiple takeaway boxes. The kid survived, surprisingly. Next story. I don't work on a maternity ward, but I've had 4 adopted nieces and nephews on my husband's side and 4 on mine. If you can't stay away from drugs or alcohol, you shouldn't be having kids. If your kids keep being taken away by the state, you shouldn't keep having kids. If your husband or boyfriend isn't allowed near children, you shouldn't be having kids. Also, if you abandon your child, or even grandchild, you shouldn't be allowed near them ever again. I know it's not the job of a grandparent to raise their grandchild, but if you pass them on to the state and find someone to raise when you have the capability and financial ability to do so, you deserve to not be a grandparent. I feel very strongly on the subject, as you can see. I just love them all so much that it hurts to know what the people that were supposed to love them subjected them to. Next story. Not a medical professional, but the worst case of shouldn't be parents goes to my sister and her baby daddies, particularly her eldest son's father. She thinks her coke addiction is in any way comparable to his ADHD. As someone who went to school for substance abuse counseling, I can tell you these are not at all comparable. And honestly, if I sat down and listed all their sins, I will only manage to give myself a migraine and dangerously spike my blood pressure. What I will tell you is she has never had custody of her eldest. He went to his father at roughly 2. By age 4, in his own words, and this has never changed, he decided to run away. When my mother got emergency custody of him, he was so traumatized. He was literally like a child taken out of a documentary I had to watch during my pursuit of a counseling degree on extremely traumatized children in institutions. He would fly into rages, screaming about how he wanted to kill his father at the age of 4. Court mandates he seize this man. Behavior on the father's part has not gotten better. My sister tells everyone our mother is conspiring to not let her have custody of her children. Funny that I know my mother is not doing this, and has been ripping her hair out trying to get her to see her eldest. She sees her other 2 kids, but not him. And of course, these 2 think we are the bad guys for taking care of their son. Well, that's okay, cause little dude is awesome and so smart, and we play Stardew Valley together, and I just think he's the funniest thing sometimes. Next story. My cousin is the poster child for state-mandated sterilizations. 5 kids she can't take care of. 2 of the fathers won't be eligible for parole until their offspring are well into high school. Another dropped off the face of the earth, and the only one out of jail is unemployed. She herself has never held down a job, has wasted every piece of charity on booze and drugs instead of her kids, or even to better herself. The only reason she has custody is because her parents and the total dog crap system that's CPS in her state. Sadly, those kids have zero future under her or their fathers. Next story. I work as a nurse for 4 years now, and about a year ago, I was in the delivery room helping deliver a baby, and the parents were 20 and 21 at the time. And so finally, when it was all over, I tried to hand the baby to the mom, but she looked at me and then at the baby, and with a disgusted look said, quote, "Get that filthy thing away from me." The dad wouldn't touch her either. I don't know what happened after I left the room, but I know for sure, of course they took the baby home with them and didn't put it up for adoption right away. Also, before the mom started to give birth, she was on her phone and wouldn't listen to the doctor at all while she was delivering. The dad just kept scrolling on his phone, completely uninterested. Next story. Not a nurse and not as bad as some of these, but still enraged me. I'm a birth clerk and I type birth certificates. We're required to submit the certificate within 5 days of birth to the state. Had this one couple who refused to name their child because, quote, they didn't want the state to own their child, and their lawyer said they could name it when they wanted. In the notes, the doctor threatened to call CPS on them because they wanted to discharge AMA without doing any newborn screenings. Dad exclusively did the talking, so I wonder if there is some domestic abuse going on. Next story. Not a nurse or OB, but my dad legit forgot to pick my mom and I up from the hospital because he was busy getting drunk with his friends at noon. He also was supposed to pick my name, but forgot, so I got a popular Christmas song as my name because my mom was too angry with my dad to think of anything else. My dad has 11 kids, possibly more, but unconfirmed, with different women, and he's too drugged up and drunk to care about any of us. He only stays with someone as long as they support his habit, and he's really good at finding women who are scared of being alone. So not making light of the situation definitely sucks. I'm just curious what OP's name is here. Named after a Christmas song. I wonder what that could be. I don't know anyway. Let's move on. Next story. My top 2. Alcoholic mom who continually drank up so much through the pregnancy that her baby had no nasal bone and would be born with a host of other cognitive and physical complications, brought in by ambulance for preterm labor, with a huge takeout iced tea in hand with so much rum in it I could smell it. Or the mom came in, again by EMS, and screamed her baby out while high as a effing kite on crack. She was like a caged wild animal. Trauma and addiction are such absolute black holes to some people that they just can't get out of and suck in everything around them, including their children. Next story. I have a lot of stories. The one that sticks with me is the girl who was sick of being pregnant, so she tried to strip her own membranes to induce labor with a metal coat hanger. She developed significant chorioamnionitis, and the baby was born septic and had to be emergently flown to the nearest NICU an hour away. After she gave consent to some treatment over the phone, because she couldn't go as she was so ill with her infection, she asked me that if it needed a blood transfusion, would they test the blood so that it would not get an infection? I said that it was a baby boy. It was her son, and asked her if it had a name. Her husband showed up with his arm full of comic books, a sleeping bag, and a bag full of 2-liter bottles of Pepsi. He was camping out on the floor of her room, and I asked who was at the NICU with the baby. He looked at me with a blank stare and was like, how would a baby know the difference? Besides, he had to stay close to home so that he could leave every couple of hours and go let the dog out, or it might pee on the floor before his mom got there. When his mom got there a few hours later, I was the night shift nurse, and it was still my shift. I crap you not, that woman slapped her son upside the head and told him to go to the NICU now, that he should have dumped the food on the floor, filled the bathtub with water, and propped the back door open so the dog could go outside to pee. These were 2 pretty young parents, but they had spent the entire pregnancy not really understanding that this was another person coming into the world. They really didn't think of the baby as if it were a human being, just something making her fat, and after she delivered, something they had to deal with, but not important enough to stay with as he lay, possibly dying, in a critical care incubator, sick because she was just over being pregnant, and thought that she could induce her own labor a little bit early without really thinking about anything that she would do affecting her infant. That's pretty much my first indicator of someone who shouldn't have been a parent, is when they call their baby it. And let me say that I speak for myself and probably a lot of our listeners here. That slap that mom gave her son, oh, that was just so satisfying to read and hear. Like, man, let him have it. What an idiot. Next story. I'm an NICU nurse, but I have a story. As NICU nurses, we need to be there in every delivery, especially in critical cases. We also have to be there to teach parents a few things after delivery, such as how to feed their newborns, at least where I used to work, and always remind the parents that if they have questions relating to the babies, to just come to us so we can help. I had a dad come up to us holding his newborn son with an innocent question at first, mostly about how to tell if his son has peed already. I was with a colleague at the station and just explained that some diapers have indicators outside, and if not, then to just check the diaper if it's wet. He then nodded and said thanks and followed it up by saying he's been flicking his newborn son's balls repeatedly to make the baby pee and has been wondering why the baby cries after instead of peeing. My colleague, who also stood in shock with me, responded with, "Well, do you flick your balls to pee? Wouldn't you also cry if I flicked your balls over and over?" And the dad just giggled and walked away. Next story. Not as bad as some of the stories in here, but still. I'm a midwife/IBCLC, and I work in a center where women go after giving birth to recover and rest. It's quite common in Asia. Babies will stay either in the nursery or in the room with the parents. I remember visiting a room to check how breastfeeding was going. In the span of the 10 minutes that I was there, the dad called the few days old newborn baby a naughty boy twice for making a small noise. Not even a full-blown cry, just a whimper, and the dad immediately went, "Don't cry, you! Don't be a naughty boy! Bad boy!" This is a culture where beating your children is fairly common, not illegal, and many families have sticks to do this with and start from toddler age onwards. My heart breaks every time I hear about this. Next story. Not an OBGYN/postpartum, but I was floated to help on peds until they got another nurse to come in. One patient was a 12-year-old girl with anorexia. We had a feeding tube for nutrition, but were heavily encouraging her to eat. It didn't matter at that point what, we just wanted her to eat anything. Her stepmom was staying with her, but had stepped out when I brought the girl's lunch tray. I was chatting with the girl, and she picked up a chocolate pudding cup from her tray and took a couple bites. I was inwardly ecstatic. This was a really big deal, as she hadn't touched food in the 5 days she had been there at that point. Then her stepmom walked in, saw the pudding cup in her hand, and said, "Really? That's what you're going to eat? Pure sugar." Rolled her eyes and walked back out. The girl put it down, disengaged, and would no longer eat or speak. It took everything in me to control myself with that stepmom. I honestly had to go to the break room and shed some tears and pull myself back together before I could continue. Next story. My mom fostered a brother of a girl this happened to. She was 12 and 2 months pregnant when they found out. But the brother was in foster care because the mom had no contact and the dad was in custody for killing the guy that did it. I'm not sure how many years he got, but this was about 15 years ago, and he's not in prison. Unfortunately, when the brother turned 18, he killed someone, and he's now serving life. It's the one thing my mom and I reflect on, since the brother was such a sweet kid. Next story. This is my story. I'm not an employee. My sister-in-law and I became pregnant within 30 days of each other. She's 5 years younger than me, so we don't have a lot in common. We met up for a Sunday picnic with all of his family one day. Super large family. I was surprised that she was smoking cigarettes and drinking Mountain Dew. Of course, I did not say anything, but remembered thinking that those were not great choices. Fast forward to a month after the birth of my healthy baby. I received a collect phone call from the jail. My sister-in-law was arrested because she and her baby daddy had been stealing building materials from the hospital for drugs. They were staying in the Ronald McDonald House for free while their daughter was in NICU on methadone, trying to come off of her addiction to heroin. Until that call came, my husband's entire family thought that mom, his sister, dad, and baby were all happily staying with the dad's, parents. They had hid the drug use from our family and the fact that her baby was born addicted. Very long story short, my husband and I met the baby and she was 29 days old in the NICU. She screamed so incessantly that the NICU nurses had put her in a room. It was a glorified closet, with a door just so that they could mute the crying. The only people that held the baby were the doctors when they had downtime. They would come hold her while they did their notes, and the nurses that had free time would come hold her. Other than that, she laid in her hospital bassinet screaming. When we arrived, the hospital staff was so disgusted with us. My husband and I felt guilty by association. All these nurses couldn't understand how we could just let this baby rot in the hospital alone, but we honestly had no clue. We had been busy with our own young family, and we came to take care of her as soon as we found out. We took her home and she was 31 days old and she required constant holding and very tight swaddling for months straight. It was a lot. Naturally, his sister went on to have two more children and she has custody of none of them, but that's another story for a different post. Long story short, if you've been considering being one of those volunteers that holds the babies in the NICU, do it because they need you. Next story. When I was a student nurse, I went to a school that had a great special needs program. There was a 7-year-old who was born deaf with no ability to ever hear. The parents never learned sign language. They basically sat them in front of a TV all day and only communicated via gestures. So the teacher was trying to teach sign language. Every summer, the progress would go back to nothing, so the teacher had to start all over. The parents were offered free classes so many times and just wouldn't take any classes. It broke my heart that this child may never be able to communicate because of their parents. I tried to understand the parents, but it wasn't a budget or time issue. It was the lack of desire to learn. The thought that you wouldn't do anything in your power to help your child just sickens me. I know moms who have special needs children, and they're the most amazing people I know. Next story. I'm an NICU nurse. There's many that come in on various drugs, causing awful withdrawals for their babies. Babies who have been born early because of dads violently punching or hitting mom's stomach. Babies born with severe brain issues because they refused a C-section even when it became emergent because the infant was in distress and they had prolonged severe lack of oxygen in the womb, etc., etc. The list goes on. Some of the worst aren't just drug babies, IMO, but when they come in popping out a drug baby every year who withdraws for weeks or months. Mom leaves the hospital, AMA, and infant goes into foster care, and they just refuse birth control and end up giving us another one the next year. Those ones are so hard emotionally. I've even seen ones born to mothers with such out-of-control, untreated syphilis that it caused the baby to develop hydrops, a fatal condition that caused an obscene amount of swelling in the tissues, free-flowing fluid in the abdomen, pleural effusions, fluid in the sac surrounding the lungs, preventing them from having room to fully dilate, etc. Next story. I worked on pediatrics ward at a military hospital, and we had 3 cases, definitely, and 4th questionable. 1. Mother let 9-month-old baby girl sit with high fever, 109 degrees by the time she got to the ER, for a week. Mom never showed up, and Dad was intermittently there. End result, baby girl left blind and deaf due to meningitis. 2. Mom frustrated slapped 3-month-old baby, handprints still visible that evening. 3. Baby born serious medical. Again, mom no-show, too busy taking care of the other kids at home. Dad worked upstairs from me, 6th ward L&D/postpartum on the weekends, and he would be at the club. 4. Lady was still nursing 5-year-old son. She explained it was normal and other cultures were doing it. Bonus, father was giving infant daughter a bath and didn't test the water, severely burned private area. I hated doing dressing change. Again, no mother but father present. You know, I believe he didn't know better because when he was there, he had to be supervised. He was very caring towards her. Just writing this really shows that some people don't need to be parents. Next story. I'm not a healthcare worker, but my youngest was in the NICU for a while. She was in 2 different rooms during her stay. We would rotate our time, so someone was with our baby 99% of the time, and we never saw anyone visit either of her roomies. The hospital had rules about locking down the NICU more than it already was, so no one in or out anytime a baby was removed from their parents for drugs or other reasons, and again when that parent was discharged. It was absolutely shocking the number of times that happened during our stay. Next story. When I was a paramedic, we responded to a trailer in the middle of the woods for active labor. The girl was 23, pregnant with twins. They were going to be her 6th and 7th children. Her oldest was a boy, no more than 8, and he was holding the 1-ish-year-old on his hip like he did it every day. The house had no electricity. There were buckets of water on the porch like they hauled it in from somewhere. The entire area around the trailer was grown up about 2 feet deep with just a small trail and from an old minivan. The cops responded with us and said they were going to contact CPS and told her they would stay with the other kids until her mom got there. I later saw one of the cops and he said CPS immediately took the 5 at the house and he had taken their pet to the Humane Society. I never found out more, but truly hope they didn't let her leave with the twins.